Hi, hello everyone. Welcome to Dr. Ravichandra Official. Please like, share, and subscribe Dr. Ravichandra Official for more interesting videos on your pathology. Today, in this video, we will discuss a new topic related to your blood bank or transfusion medicine, that is blood components. Blood is separated into various components for various purposes. So, the main blood components that are being used regularly are packed red blood cells, platelets, that can be random donor platelets or single donor platelets. It is also called as platelet rich plasma, fresh frozen plasma, and cryoprecipitate. Fresh frozen plasma consists of all clotting factors, and cryoprecipitate is rich in fibrinogen, factor 8, factor 13, and von Willebrand factor. Coming to the storage temperatures, so the packed red blood cells should be stored at 2 to 6 degrees centigrade in a refrigerator, and fresh frozen plasma minus 18 degrees centigrade or minus 30 degrees centigrade in a refrigerators, and cryoprecipitate minus 18 degrees centigrade or up to minus 70 degrees centigrades in the refrigerators. But when compared to all the other components, the platelet rich plasmas, that RDPs or SDPs, should be stored at 20 to 24 degree centigrade, that is at room temperature, in a platelet agitator with continuous agitation, so that the platelet should not clump or aggregate. Okay, coming to the shelf life. The shelf life for a cryoprecipitate and fresh frozen plasma is 1 year, and the platelet rich plasma can be used for 5 days. Shelf life is 5 days. Coming to the packed red blood cells, packed red blood cells shelf life depends upon the anticoagulant that is being used in the blood bags. If the anticoagulants are CPD or ACD, that is citrate phosphate dextrose or acid citrate dextrose, the shelf life of the packed red blood cells will be 21 days. And if the anticoagulant is citrate phosphate dextrose adenine, then the shelf life will be 35 days. And if the anticoagulant is citrate phosphate saline adenine glucose mannitol, then the shelf life will be 42 days. These 21 days, 35 days, 42 days can be even remembered as 3 weeks, 5 weeks, and 6 weeks. Okay, and you have to remember one point: these temperatures are to be maintained before transfusion. If a blood bag is issued from a blood bank, then it has to be transfused as soon as possible. A packed red blood cell should be transfused within 4 hours, and platelet rich plasma or fresh frozen plasma or cryoprecipitate should be replaced within half an hour to 1 hour maximum. If there is any delay after the issuing of the blood bag to the wards, then the sister or the nursing staff should send the bag send back the send back the bag to the blood bank for storage. Regular refrigerators that are in the wards or labs or in the homes will not serve the purpose. Please, this point has to be remembered and taken care a lot. And if the platelet rich plasma, if it is maintained in even in the blood bank, if there is a current shutdown or there is voltage drop, then that platelet should be transfused within the same day, so its shelf life will decrease to 1 day. The fresh frozen plasma and cryoprecipitate are slowly brought down to the room temperatures. Once it has been brought down to the room temperatures, then it is called as thawing. And once the thawed, that fresh frozen plasma and cryo should be used within that stipulated time, that is within 1 day and maximum 2 hours. Emergencies. Coming to the use, packet red blood cells are used in chronic anemias, acute anemias, and when there is significant blood loss. When a whole blood is transfused, we can expect around hemoglobin percentage 1 to be raised, and if we are giving packet red blood cells, then there will be approximately max 2% hemoglobin will raise. Coming to the platelets, these platelets can be RDP and SDP. Random donor platelets will be approximately around 50 ml and they will raise the platelet count around 5000. Whereas SDP, it is separated by platelet apheresis using a apheresis machine. So this will have more platelets and it will be around 300 to 350 ml. When it is being transfused, then the platelet count can be raised up to 50,000 per mm cube. Okay, and this PRP, platelet rich plasma, is generally useful in healing and regeneration of the tissues. So whenever there is any decrease in platelet count, these PRPs are advised. Fresh frozen plasma is useful in coagulopathies, clotting factors replacement, and in managing the bleeding because of the liver disease or warfarin overdose. Coming to the cryoprecipitate, they are being used for bleeding disorders and mainly in disseminated intravascular coagulation. Thank you for your patient listening. Please like, share, and subscribe Dr. Ravichandra Official for such interesting videos.